Welcome back to Achieving Unlimited Health with Dr. James Cima. Today, we're opening one of the most misunderstood parts of health, blood work. But we're not really talking about the basic, normal, or abnormal printout that most people get once a year. Dr. Cima is going to show us how labs are really a map, a direction, not just a diagnosis. Really, a way to understand the chemical side of your health, how it impacts the physical and mental, emotional sides of the triangle, and how to make daily decisions with confidence instead of guessing. So, if you've ever wished your body came with instructions, this episode is going to feel like finding the owner's manual. So, hi, Dr. Seema. I'm so excited
Hi,
to talk
Mother.
to you. Always excited to talk to you.
No, this is gonna be a great actually, it's gonna be a great episode, and I'd like to probably it's gonna be maybe a little bit longer than this episode, but we'll cover as much as we can. A lot of what we talked about with the nutrition already, like talking about body toxicity and eating the wrong foods and having hormonal imbalances, that's what the blood tests will basically explain to us. So I'm going to just like step back because back in the 70s, quite a few years ago, or quite a few decades ago, I knew I wanted nutrition in my practice. And I said, I need to like figure out a way to get it into my practice. But more importantly, like what would I need to know to help patients? It wasn't like I'm trying to find a diet out for me. It was like any patient that came into my office, regardless of their health concern or their age or whatever, I needed to figure out a way to kind of help them with their nutrition. And it would be their diet for one, and then also recommending certain supplements for two. So the first thing I said was, I need to have some kind of a tool to help determine what kind of foods people should eat. Because each person is unique. They come from different backgrounds, different heritages. And so therefore, they're going to be eating different kinds of foods. The second thing was too, in today's world, even back then, who had diabetes, who had digestive complaints, who had liver problems, who had their gallbladder removed, their appendix removed, some of their intestines, and all kinds of other organ and glandular dysfunction. So you'd want to see like, well, what kind of a test could I use to help determine that kind of a situation? And it was like amazing because when you ask the right questions, your mind gives you the right answers. It may not necessarily be overnight, but if you ask the question in the right way, the mind will respond. So within maybe a year or so, I learned from two different doctors. One was using a blood chemistry analysis, which was great because all doctors would use that as a tool, a diagnostic tool for blood chemistry. And, your blood chemistry is really your fingerprint or your biochemical blueprint to you. And so when your blood test that basically comes from a person, or one of my patients, for example, I can look at that blood test 5-6 months later and pretty much know it's the same patient or the same person because it's repeatable. And also it's accepted by all professions. And on top of that, it's objective findings. I mean, you can't say, well, you have this. The blood test either tells you have a thyroid malfunction or a liver or gallbladder, or you don't from a biochemical perspective. So I had to learn a way to figure out what we can do to determine that. And there were two doctors. One was using the blood chemistry analysis to determine diet, and the other one was using the blood chemistry analysis to determine organ and glandular malfunction, and then determine what supplementation you should take. And I said, well, this is great because that's exactly what I want. So I started to study the blood chemistry analysis, and over decades and working with thousands of patients, you start to see trends and you start to see a lot of different things that are going on. It's really become really drastic because we talked about like the biggest health face in the United States today is obesity, or just people, I think 72%, it's approximately 72% of the people in the United States are overweight. 42 or 43% are obese, and 11% are morbidly obese. And the statistics are getting worse and worse and worse. And so, a lot of it comes down to the foods that you eat. But a lot of people don't understand like why you should eat the certain foods that you should. And the blood chemistry analysis kind of helps you do that. It helps you really determine what the person should and shouldn't be eating. And the great thing about a blood test analysis is like you follow it up in 6 months or 5 months or whatever it is, and you start to see the changes. And you start to see really good changes. So that's what you really want to do. So the one doctor who actually started to work with nutritional diets was a William Dr. Kelly. He was a dentist. Mostly a nutritionist back in the 1900s were nutritionists too as well, because they work with people and they work with dentistry, and they saw a lot of gum disease in the United States and a lot of dental caries. And they looked at other populations throughout the world, and they didn't suffer like we did with that. So they started to really look at a lot of different things from that perspective. And Dr. Kelly was one of those doctors who really was interested in that and wound up developing, and this is back in the 1950s, pancreatic cancer, and which prognosis is dubious. You're not going to live more than a few months. Even in today's world, the chance of you living, for a few months is slim to none. But he was back in the 50s. He said, well, I'm going to do nutrition. And he started to treat himself with nutritional supplementation. And he lived, I think, until 2010 or something like that. So he lived a long time after that. And so he started to do a lot of lecturing on his program. And he called it metabolic typing. He would use blood tests, approximately 15, to assess, what kind of food you should be eating, I thought that was really great. And he called them metabolic types. And it's funny because today they're called ketogenic, Mediterranean, vegetarian, and that kind of a paleo, that kind of a situation. So I see a lot of patients, well, I'm going to go on a paleo diet, or I'm going to go on the ketogenic, or I'm going to do this. It's like, you don't know what your body needs unless you do a blood test, because that'll kind of tell you and actually reinforce, because a number of times when we figure out what kind of foods the patient should eat, it's more important that they look at the foods and go, I like that. I like that, because if you put a patient on a nutritional program that they're not going to enjoy the foods, they're not eating it. I'm sorry. I don't like mung beans, and I'm not going to eat them because you told me I'm going to be able to lose weight. So I need another way. So he decided to determine what kind of foods would be right based on these metabolic types. And now here's the real kicker, because I'm going to kind of go into some detail. If I go in too deep, please let me know. This is really the crux with a lot of people, their overall health problems. They just don't get it. And because they're always thinking oh, I'm going to restrict my calories to reduce weight. Worst thing in the world to do. Okay. Or I'm going to restrict my calories and work out really hard, which is doubly the worst thing to do. So, they don't really understand what's going on. And when you look at utilizing metabolic types to determine what kind of foods you should be eating, you'll start to see chemical perspective, a true chemical perspective, what's going on. So now, with that being said, and I'm going to try to make it as simple as possible, there's a scale. It's called the pH scale. Okay. And the scale it goes from 0 to 14, and 7 is water. Okay. Anything below 7 is considered an acid. The lower the number, the stronger the acid. The same thing with if you're over 7.0, anything above 7.0 is they consider it a base. And the base, the higher the number is, the stronger the base. And both can be really caustic at certain times. Now, if you understand the scale, it's going to be a little bit simpler to understand. Now you'll realize why you'll be gaining weight, or why you can't lose weight, or why you have all these chemical imbalances. The pH of cells in the body is 7.2. It's supposed to be that way. It's a little bit more basic than water. Now, what that means is that all the membranes of all the cells in your body, and there's 100 trillion, okay, have to be at a pH of around 7.2, 7.3. If it goes 1 or 2 tenths of a point higher, you can become very sick really quick, or 1 to 2% lower, and you can be deathly ill as well. So it's very important to keep that really well balanced. So now the importance of that is it's twofold. One is that when you're at 7.2, everything that flows in and out of cells through the membrane can kind of go in and go out the way it's supposed to. If the balance is too alkaline, okay, then you tend to prevent things from getting in and out of cells. So the cells start to bloat. Now, these types of people, you start to see that they always like what they eat. They always feel bloated. They feel constipated. They can't urinate. It's just they always feel puffy regardless of what's going on. I eat this, I just feel puffy. I have a digestive problem, whatever it is. No, it's more of a pH problem that's causing that. And the same thing, if you're too acid, things flow in and out of the cells way too quickly, so they don't get utilization from them. And these are the people that are always stressing out. They're always running to the bathroom, urinating. They start to sweat profusely for no particular reason. And that's the exact opposite. So what you want to try to do is, you want to try to maintain a pH of around 7.2. Now, here's the important thing that people don't understand is that you get through the foods that you eat. There's only two types of foods out there. They're either called acid-forming foods or alkaline-forming foods. Alkaline-forming foods, put it this way, alkaline-forming foods are pretty much your fruits and vegetables. Foods that basically, are everything else but, whether it's going to be meats, dairy, fish, fowl, so on and so forth. So that's two types of foods that you can eat, and that's how you balance the pH of your body, by balancing the acid and alkaline-forming foods in your diet. So this way, everything starts to feel good. You don't feel bloated anymore. You have no problems with gaining weight or losing weight because everything's flowing the way it's supposed to flow. Does that make sense?
Yeah. And this is something I think that you maybe mentioned previously, but you said that health isn't an absence of symptoms, but it's a state of wholeness. So, how does blood chemistry reveal that state of wholeness long before symptoms even begin to show up?
Oh, that's a very good question, because what happens is that with all blood tests, they give you a reference range, and the range goes from, let's say for your thyroid, for T4, it goes from 4.5 to 12.5. That's the average scale. Now, with that being said, if you're over 12.5 or under 4.5, then you're sick and diseased. So you have to have problems. You might have problems with your thyroid or your pituitary or your hypothalamus. It really depends on what the other tests show. But the reality is that, they kind of like do anything until it's like you're out of range. And they don't realize, like, why not do something before you go out of range, while you're starting to have a tendency towards going to the high side or the low side. But what happens with health, everybody has a strong constitution when they're born. Most people are born healthy. And over the course of the next 5, 10, 15, 20 years, being hit with chemical, physical, and mental emotional duresses, their body starts to break down. So you go from health to, an abnormal health to sickness and disease. So there's a situation where you have normal physiology, then you have abnormal physiology, and then after that you have disease. So the doctors a lot of times don't think about the abnormal physiology as being a problem, but that's what's going to lead to the disease. So we look at things, we narrow those ranges down. So 4.5 to 12.5 becomes like, let's say, 6 to 8 or 9. So we can start to see if there's a tendency towards a problem, either low or high, before it gets to that critical point. And then we can start to utilize supplementation to help improve that. That's what I loved about the blood test, because you don't wait until you have diabetes. You don't wait until your gallbladder has to be removed. You can start to see these trends way before that happens. And that's the good thing about a blood test, because if you run the same blood test, year after year after year after year, you're going to see patterns, and you can break those patterns at any one time. But those patterns will eventually lead to disease, and then lead to disease, then we're talking surgery and medication at that particular point. So the blood chemistry is one where it can kind of like show you the future and help predict the future, because you can look at it and you can tell to the patient, look, you're either going to have a heart attack in the next few years, or you're going to have to change. And a lot of times people like that they can at least say, okay, fine, what could I do to help prevent that? And whether it's my diet, whether it's going to be, exercise, what supplements to take, and anything else that you can basically help, with that particular problem, that's what you want to do. So it's a blueprint of what's going on in your body.
Absolutely. And speaking of that, how do you teach patients to really see labs as more so directional versus diagnostic? Is there a mindset shift, or how does that work?
No, we give them the whole report. We literally give the patient the whole, we call it the patient report, that explains to them like what organs and glands are weak, what those organs and glands do, what supplements to take to help, repair and rebuild those glands. Because what you want to do is, when you find a weak or let's say stressed gland, you want to kind of repair and rebuild it. And so you have to know about different kinds of herbs, or different kinds of homeopathic remedies, or different kinds of what we call tissue concentrates and vitamins and minerals that can help stimulate that gland organ. And then after that, you'll find out, follow-up blood test, exactly what's going on.
Then, so can you explain the difference between clinical ranges and optimal ranges, and why that really matters for people who are trying to get ahead of diseases?
Yeah, because that's what I was just saying. Those clinical ranges are the ones that we call physiologic, and they're like narrowed down so that this way, if we start to see a tendency, and we're not looking at one test, Layla, we're looking at multiple tests to determine like an organ malfunction. So if I'm looking like, use the thyroid because it's a pretty logical test for most people to assimilate, is that your thyroid's either low functioning or high functioning. But then if the thyroid is involved and the pituitary could be involved, the hypothalamus may be involved, it may be a problem with the liver. So we're looking at a whole bunch of different clusters of glands and organs. And then with the blood test and with the calculations that we utilize, we can kind of say, okay, this gland has more stress on it than this other gland does. So we'll support that one. But then you have to look at, does that other gland support this gland in any particular way? So it takes a while to really understand it, but the patients can see it because they're going through it. They're going through it. Like, for example, they'll be talking to me and they'll go, I can't lose weight. And then we'll look at like what they're eating, and it could be their metabolic type. It could be that they're eating totally improperly if they should be doing. And then they're eliminating certain foods that they should be basically taken in. And so it causes their body to malfunction, and that malfunction starts to show up in the ranges of a whole bunch of different blood tests. And as long as you know like what those tests mean, because each test tells you something about specific glands and organs. So it's kind of like giving you, some information as to what's going on. That this way, if you really understand how the body works, then you can figure this out. I mean, obviously, a patient's not going to be able to do that. But when you give them the roadmap and you say, look, this is why you can't lose weight, and they start doing it and they start seeing the changes with their body, they can't believe it. But it's all based on just, eating the right proportions of food and the right foods. And if you stay away from the right foods, you're not going to repair and rebuild your body.
So, what are some biochemical clues that really tell you someone is struggling with chemical stress, or things like maybe nutrient deficiencies, inflammation, or hidden toxicities?
Okay, yeah, those are good questions. There are certain portions of the blood test that tells you about immune function. And with immune function, they'll tell you like if your body's under a lot of duress from bacteria and virus, or you're having problems with toxicity, or you're having problems with inflammation. So we can kind of see those things. So if a patient is telling me, I'm having problems with, inflammation, I just always feel swollen and tight, then you can look at those markers. Then we have like a lot of hormonal markers. We have markers for the heart. We have markers for the pancreas. Like, for example, a lot of times a patient that comes in that they're diabetic, you can see if it's a problem with just their pancreas that's causing the problem with insulin, or is there a problem with the liver or the adrenals that are really impacting the sugar level. So it's kind of like looking and trying to figure out what's going on with that patient, so that this way you can pick certain tests that relate to each particular gland and organ in the body. Like, for example, this is what a doctor will do. Okay, cholesterol is the biggest hoax they ever saw in perpetuate besides COVID-19, but cholesterol is a big one. That's got people on statins for decades, and it's creating a lot of the health issues that we see today, from premature dementia to all kinds of other issues with hormones and all the different things that I spoke about previously. But cholesterol levels at this particular point, they could be lower and lower and lower, and the doctor will say you're fine, it's good. And it's not good, because the cholesterol is really important for body use. The liver produces 80% of it. So what you want to do is figure out like, okay, where are some of these markers that they way back when, which ones are true and which ones aren't. That's another thing that's going on too. They don't know. I mean, I'll look at a test called SGPT, what they call it ALT now at this particular point. It's a liver enzyme test, and you'll see the range between 0 and 40 or 0 and 50. And it's, because they don't see anything wrong with a low SGPT, and they'll put it down to 0. But if you look at it and you think about it for a second, it's a liver function test. If the liver is dead, then it's 0. You know what I mean? So you can't wait to be at 0 before you do something with the SGPT, because the liver's just barely working. It's the exact opposite of someone who has a situation with alcohol and they have, some kind of liver damage or liver disease. So, or hepatitis or something like that. So, that's what the blood test pretty much does, is it really figures out which test, and each test relates to a certain gland or organ. And then we see clusters of tests to do that. So the average doctor, like we're talking about with the cholesterol, he'll see your cholesterol a little bit low and he'll put you on a statin. And that's all he'll do.
And you touched on markers. Which specific markers really help you understand someone's nutritional needs? For example, proteins, minerals, B vitamins, antioxidants.
All of them. All the above. They all play a role. It's all like looking at everything and then trying to figure out, which glands or organs, because they all relate to glands and organs. So if I look at your protein levels, or I look at your cholesterol levels, I'm looking at, it could be your adrenals, it could be your sex organ, it could be your thyroid, it could be your liver, it could be a whole host of things. So when you're looking at each particular test and you're looking at how far that test is out of range, and you're looking at clusters of tests that relate to that gland or organ, you now know how that gland or organ's functioning.
And how do labs uncover overloads from processed foods or environmental toxins or chemical stressors that people might not even feel yet?
How does the body deal with it?
How do the labs really uncover those overloads?
Because you'll see those tests being out of range. Like, for example, you'll see, like, if you're like looking at body toxicity, one of the big things is white blood cell counts are really low. White blood cell counts are really high in infections, but really low in toxic reactions. So you'll start seeing the body toxicity even at that level. But then you'll see like liver overload. So you'll know that the toxicity is coming from the fact that the liver is overloaded. Or it could be, a problem with the thyroid, which is affecting the liver. So it's looking at everything and understanding what's going on. Like, again, every biomarker out there is important to some degree because it relates to some test of gland or organ. But it's not the only thing that matters. Like I said, with doctors, they'll say, oh, high cholesterol, low cholesterol. Oh, we have high cholesterol, we're just going to give you a statin. And there's so many organs and glands that control your cholesterol levels that you'd have to sit down and like figure out which one it is that's either causing the problem with your cholesterol or really not causing the problem with. So that's the real key.
And how can blood work reveal whether someone's physical training is helping them or actually pushing their body into overstress?
But that's another good question, because you can see that when I look at, remember we talked about high and low? So every blood has a high and a low value. When you look at a graph and you start to see on every test that you do, and we do 75 tests, so it's not like we do 12 tests, we do 75 tests. Now, if you see the majority of those biochemical markers low on the low side of the range, let's say the range between 4 and 10, and you see most of your markers like 4, 5, 6 and stuff like that, that means your metabolism is like, that can mean that you're either overtraining, people tend to push themselves too much, or you're not eating enough. And so you'll tend to gain, believe it or not, you'll gain weight like that. So it tells us like metabolically what's going on. So a woman comes in, and this is a typical scenario. They're in their 40s. They've had a few kids. The kids are now like 10, 12, 13, 14. They have a good maybe 15, 20, 25 pounds of weight on their bodies, and they want to get rid of it. And they've been trying to do some type of different kind of program that gives them a certain amount of calories a day, and that's what you stay with, and you do this and you do that, and they're still not losing weight because they're pushing their bodies by exercising too hard usually, and they're not used to it, and hormonally they can't balance. So you have to really look and see like, okay, this is the way you're going to eat, this is the way you're going to train, and it's going to take some time to get your metabolism back up, and once you do, you're going to feel great again, but it's going to take time.
Absolutely.
Some of the women can do it, and it's not simple because you got to change your diet, and not to a diet that you don't like. You love your diet. I mean, that's what I want. I don't even like to use the word diet. It's your metabolic profile. When you're on your right metabolic profile, you're eating food you enjoy, you feel good, and you're not having any big issues with weight. And big thing is you can control your weight. And by doing that with the foods, like I said, you balance the pH of the body, and then you get foods flowing in and out properly into the cells, and then you start to feel better and better.
And then can chemical markers show when mental and emotional stress is affecting metabolism or inflammation or recovery at all?
Yeah, if you have patients, like, for example, if you're on the wrong nutritional profile, you're going to watch through the course of a day, you're going to have ebbs and tides. You're going to have like, I kind of feel like I got a lot of energy, and then all of a sudden you're going to crash. Okay. And you're going to say like, I'm tired, I need coffee, and you're drinking the coffee and you're putting whatever you're putting in there. It's kind of helping, but you're kind of dragging yourself through the course of a day. Okay. Or you're the type of person that you have to exercise, and you drag yourself to the gym to exercise, and you can't do what you want to do. So it affects you emotionally. And by the way, the majority of the sugar in your body, glucose, okay, I think 60% of it's used by your brain. So think about if your sugar drops too much, you become hypoglycemic. Now you're like walking around like, you're in a daze, you're in a fog, and you just don't feel right. You can't think straight and things like that. So those big things that I see with a lot, they'll tell me that. They'll say, I just go to sleep, but I don't think I'm really sleeping. And, I'm up half the night and I'm not getting good rest. And a lot of that could be caused by biochemical imbalances, based on the foods that you're eating. And if you eat the right things, you can kind of like be satisfied for a lot longer period of time.
Absolutely. And where do you see the biggest triune disconnect where labs may say one thing, but someone's lifestyle says another?
It's there. It's all the time. It's just telling you exactly what it is that, you have to do. And if you have a lifestyle that's, crazy, then you're going to have to start changing it. If you don't, it's just again, with the blood test, the part about it is you can do one 6 months from now or do one a year from now, and you'll start to see the ramifications of what you're doing right now. Because every 6 months to a year, I don't know if most people don't realize this, you have a brand new body. You have a brand new body. Problem is, it's made from the old body parts. But if you make the old body parts a little bit better, because the body can do that, then you can be healthier than you were 6 months to a year before, as long as you make those changes. And I've seen that happen, but I've also seen the exact opposite. You don't do it, and the changes get to a point, like you were just saying with your pup just now. It's like great, and all of a sudden, 2 days, it's the same thing with patients of mine. They're doing good, and all of a sudden, it's like they start going after one sickness or disease after another, and within sometimes weeks to months, they could perish.
Yeah.
And it's all because it was like, well, I didn't really take care of it, and I don't think it was really bothering me that much, but it was.
And once you see the full blood chem map, how do you determine what someone should eat or avoid based on their unique markers?
Yeah, what we do is, like I said, when I get the blood test, in fact, what I like to do with the next talk is to, actually put up my whole website to show you. I put together a test example and kind of show you exactly how we figure all these things out. And it's pretty cool. It's really nice. It's really interesting. And then we kind of give you the patient's view of what it is that we found. So this way you can pick, what kind of food you should be eating, the glands and organs are weak, things to avoid and things to keep down to a minimum, and start to help you prepare yourself to, start to eat right and make sure you're doing everything in your power to kind of stay within the healthy range of proteins, fats, and carbohydrates. Like, for example, most people don't realize, and just as the basic tenets, is that there are three types of foods: proteins, fats, and carbohydrates. That's all there is. Okay. If you look at a hierarchy of what each does, proteins is number one, fats are number two, and carbohydrates are the lowest. And if you look at most people's diets today, they go, well, they want you on all kinds of carbohydrates, cereals, rice, vegetables, salads, and stuff like that. And that's nice, but that only makes up about 2% of the body structure. Most of it's water, 40-50%. Protein is the next most important thing that makes up your body. And then it's fat. In this society, fat is more than protein on most people's bodies. That's why they're obese. But the protein levels should be really high. And protein, if you just eat protein, it can make fats and carbohydrates. Fats and carbohydrates can't make proteins. So there's actually a whole new science coming out. It's called peptides. And everybody's going out and getting peptide shots and all the rest of this stuff. They don't realize that your body makes the peptides. It has a process called deamination and transamination that can move amino acids around and make one peptide into another one. So as long as you have that kind of going, you don't necessarily need to have peptides. But in today's society, cholesterol has been given such a bad rap, and cholesterol is always found with protein, that most people are protein deficient. So, meats have a lot of protein in them, but, because of the cholesterol levels, they said stay away from that. Eggs have a good amount of protein, and because they have the yolk in the yolk has cholesterol in it, but it also has other factors that help emulsify the cholesterol. They consider that still bad. But chicken's okay. It's like, where did the egg come from? It came from the chicken. Why is the chicken freaking okay? The egg is horrible. So it's like that kind of insanity that people are like, oh yeah, okay, I won't eat eggs anymore. I love them, but I won't eat them. It's like, are you kidding me? Listen to your body. Like, learn what your body really wants, and then figure out if that's going to be something good or bad. Like, a lot of times people will they say they crave carbohydrates, sweets, but they don't. They crave fat. Fat tastes sweet. So people kind of like look at a fat like cake or cookies. The majority of the calories are fat. So the only thing is you're craving fat, not sugar. And the reason why you're craving fat is you're not taking a good enough amount in your diet through dairy and meats and things like that, which you should be taking in because that's a good fat. So that's what I see it happening out there. So most people are protein deficient. And if you are, you can't repair and rebuild 100 trillion cells in 6 months to a year. So you start going down, start going down, you start going down. And sometimes it's so slow that you don't even realize it. And all of a sudden, sometimes it's so fast that it's like, what can I do? I'm like already behind the eight ball.
And I think you've mentioned this on a previous episode, but how does one really calculate the best amount of protein that they should be taking in on a daily basis?
Yeah, what you should be doing is I also give the patient a chart, okay, based on their weight. And this that tells them how much protein they should be taking in on a daily basis. And it gives them kind of like some snapshot of certain meals that they can do it. And if they, eat this amount of chicken or this amount of fish or this amount of red meat and this amount of, dairy and whatever, they can get a sufficient amount of protein in. And if they need to, they can take, there are tons of protein shakes out there, good shakes, nothing like crazy. But, you want to basically utilize that just to help support your protein intake. But more importantly, you want to do it through various foods in your diet. So as long as you're doing those things, you'll start to see like, okay, when they eat this amount of protein and this amount of fat and this amount of carbohydrate, then I feel much better. And if I look at my body weight or whatever other monitors that you want to think about, okay, that you feel like I need to utilize to see like what's going on, is that as you start eating this way, you'll start seeing the changes. Like a lot of times when you start eating properly, you don't necessarily lose a lot of weight, but you lose a lot of inches because you lose some water and fat. And people will say, wow, you look like you lost a lot of weight. And you might have lost maybe 2 or 3 pounds. And so they don't realize that, when you eat, if you lose the right weight, it's not like how much weight you lost. As we talked about this before, is making sure you're losing fat and water, keeping a certain amount of protein. You can't lose too much water either because you don't want to dehydrate. So it's like, putting together everything. But when you start writing things down, that's the other thing too, Layla. Most people, if I said the biggest problem with most people, they don't want to write anything down. But they'll tell me they have a great diet. And then I'll tell them, I said, what'd you eat 3 weeks ago on Saturday night? They'll go, was that like a trick question or something? I said, no, what'd you eat 3 weeks ago on Saturday night? I don't know. It's like, how the hell do you know if you have a good diet? That's like telling me you're rich, but you don't know what's in your bank account and you don't keep score. You can't do that for any length of time. So throughout the years and decades, I realized like, it's just how many calories you take in. What are you taking in? Because I can take in on certain days little amount of calories and gain weight, and there are days I can take in 4,000 calories and lose weight. So it's not just the calories in, calories out, which they want you to believe. It goes a lot more with having the pH of the cells regulated, what glands or organs are malfunctioning. So it's a whole it's an orchestrated approach, and that's what you want to do with the patient. And it's got to be proper diet, proper supplements, and the proper workouts. People tend to beat their bodies to death, and it's like you don't do that. Don't ever do that. You want to stimulate the body. You don't want to destroy it. You just want to stimulate it. You don't want to crucify it. You don't want to do anything like that. You just want okay, I did enough today to stimulate metabolism, maybe put some muscle on or whatever it is that you want to do, or take some fat off, and that's it. So you don't have to, and that's what I see a lot of people do. They annihilate their bodies. They work out so hard, and they just and you tell them slow down, and it's like, I can't. I can't. It's like, what do you mean you can't? You can do anything you want to do. No, you don't understand my mind, my this. I said, you're not going to have a mind. You keep on going the way you're going.
Absolutely overexerting that energy and just pushing your body. And speaking about labs, right? How do you use labs to identify whether someone needs detox support, gut repair, or metabolic balancing, or hormone correction first? So where do you start with that?
It really depends on what we see and how we feel like this is what we should do. So we put together a program. But it's good that you said that because each person is going to be unique and different. So we might, for example, there might people that have really bad problems with their hormones, okay? And they're having all kinds of, whether it's emotional, whether it's they can't sleep, night sweats, and all kinds of changes that they're going through that they just don't realize, how bad it's really doing. Sometimes we might even recommend for those patients, depending on how old they are, whatever, do hormone replacement therapy. But with that being said, that's just something that you can kind of start with for certain people that are really in bad shape. And then, but you still have to maintain a good diet, good supplementation, and everything else like that to help support that. So, this way you don't have to keep on going higher and higher with hormones, because a lot of times the hormones cause all kinds of problems too as well. And so you have to go through maybe 3 or 4 different kinds of, let's say, hormone replacement therapies to find the right one for you. And again, you have to still monitor that with blood chemistry analysis. That's what doctors do. You have to monitor it because one hormone goes too high. It's a domino effect. It causes one to go low. That one causes another one to go high. And just like a whole bunch of hormones start going and start changing. And eventually what happens is that now you're more of a biochemical mess than you were prior. So we try to look at it and talk to the patient. And a lot of times they'll say, I don't want to do hormone, which I'm glad that they don't want to do it. We say, okay, we'll do this, we'll do that. But we also do work, a physical work that we do. It's called cranial work and organ work that we cranium that has an impact on the whole body anyway. And, we work with different organs and glands. So if we see a problem with, let's say, the liver, there's a lot of reflex work that we do with them, as well as the nutritional support. And then when you talked about the diets, and so we recommend a certain type of diet. If they're toxic, we'll recommend some kind of a detox. If that detox is with the liver, that's one thing, liver gallbladder. It could be with the spleen. It could be with the kidneys, kidney bladder. So wherever we see where the portion of the body needs to be cleansed, we might put some kind of a cleansing program in there as well. And then also juicing too. We might might talk to a person about juicing because they might really require a lot of different kinds of juices just to help they'll cleanse the body and just get some nice strong enzymes in there as well.
Interesting. And what, for example, with those juices, what kinds, like specific, like green juices or vegetables, did you just go off markers of the test and figure out like,
Yeah, there's a whole bunch of different juices out there. They'll basically
Mhm.
cleanse the liver. Like my favorite is apple, beet, and carrot with ginger. I love that. So I can sip that stuff all day. The only problem is it causes your blood sugar to go through the roof. So, but no, I love that cleanses the liver, and they're really good program to help the liver and the gallbladder cleanse. So if that was something that you'd look to want to do, that's what you would do. So, and then whether it's going to be something else with the kidneys, it might be something totally different.
Absolutely. And I think lab reports can definitely be overwhelming to those who don't
But
have,
no, it's great.
your expertise or knowledge. So for someone listening who may feel overwhelmed by lab reports, what's really the first step to building confidence and using data as empowerment instead of fear?
What I would recommend at this particular point, if they're really having some kind of a nutritional problem, as far as, and their blood test is showing them things that the doctors can't figure out what's going on, what I'd recommend is they can call me and give a complimentary consultation. They just have to call. The number will be 561-248-2500. That's 561-248-2500. And what we can do is set up a half-hour consultation. It'll be and if you just send me a copy of the blood work, after you schedule the appointment, I can at least look at that and tell you what I think. It won't be a complete, rundown of the blood test, but if I talk to the patient and see what's going on and they don't have any other way to do it, we can probably work with them too as well. Because I can have them do lab work throughout the country. It doesn't matter if you're, in Kalamazoo, Michigan, it does at this particular point. So we can do that because I know it's very difficult for a lot of patients when they're doing a blood test to really understand what's going on. Because it is complicated. Most doctors don't even know a lot of what's going on. And they'll just look at, again, doctors today, they'll just look at like slivers of what they used to use back in the 80s. I mean, we used to use like pretty much full panels back then. And then once they started with the HMOs and the PPOs, they started saying, well, if you're an expert in this field, these are the only tests that will allow you to do. So they only give you a few tests to do, and that's what the doctors do. So they don't really run full panels because the insurance company won't cover it, and they don't. And I guess they feel it's unnecessary or whatever, but it's totally necessary. It's really the biochemical blueprint, of your body, and every doctor would agree with that. They know that because that's why they utilize it as a great diagnostic test because it is.
Absolutely. And as a patient, you won't know particularly what to ask for to be included in those labs or those workups. So you're just
That's the other thing too, is the good thing about the labs that we use, like when they do speak to the patient, we can customize it. We don't just use a general panel. We can customize the panel for whatever it is that we want to do it. If you're concerned more of cardiac markers, we can give you more of that. If you're concerned more with diabetes and insulin levels and A1C levels and stuff, we can add some more things in that too as well. And it's just, kind of figuring out what's going on biochemically with the patient and then supporting that and then watching with weeks to months. Because it's really a program too. Because once you're evaluated, you should say, okay, look, I need to have a program, set up, and then I need to follow it. And the way you follow it is that you're writing everything down. I can have consultations with you, and throughout that 6, 7 months, make sure you're on the road to recovery or you're doing something wrong. So as long as we do have something called Body Sight, is our customized site to assess like whatever you put down, we can look at it over weeks or months and see protein intake, carbohydrate, fat, look into what kind of a diet you should have been on if you're following what you were. And you also have other markers in there too, as far as body monitors, whether it's for your weight, whether it's for your body composition, whether it's for your measuring inches, whether it's weight loss, whatever it is. So it's kind of like, pretty much set for you and what you want to achieve. So it's really individual. And that's what it comes down to because each person is individual. And nutrition is really the key.
Absolutely, that personalized one-on-one is what everyone needs. There's no blanket thing, everyone's so different.
I wish there was and isn't. And like every day on TV, I see the same stuff. This guy's selling this product and it, grows hair in a cue ball and it does all this stuff. And I'm like, how did that? You have to have some set to go on TV and start saying things like that. And some of them, a lot of these people, they're not even doctors. They just, well, I take this and I can sleep 12 hours a night. It's like, that's good. Okay. But you're not a doctor and you're selling something to people that they're thinking that's going to help them. And it's not. So chances are it's not going to help. And if it does, it's probably psychosomatic. It wasn't for the medication. And that also, becomes part of the whole criteria too. No, we pretty much covered a lot of stuff. So it's kind of like getting a good idea as to what you should be doing. And that's how a blood test will help. But we can basically, if you want the next episode, we can kind of like, instead of I can share my screen with you and we can kind of go through like a blood test, just to make a mock-up of one, the results and everything, and kind of show people how we figure out which, what kind of a nutritional profile you should be on, what gland or organ is malfunctioning, and we can put together a whole little thing to kind of show how the blood test really works. And that's what really intrigues people, because when I start talking to them about this, I don't care who they are. They love it. They say, this is great to be able to do it because I know it's going to be able to help me. And like I said, it's something that you follow up with. It's not something that you'll do once. And if you really want to maintain chemical side of that triune, okay, blood test is the best way to do it. If you do it every year, then you'll have over years and decades, you'll eventually like kind of see, things that happen, and realize that those things started to happen maybe years ago, but you can still reverse it.
Absolutely, like you said, that blueprint and that basically inside look is absolutely,
Oh, actually, it would be great because it would be a typical consultation that I would do with a patient. So except we'd be doing it with a whole bunch of patients. And it's good because they'll start seeing this and they'll go, that's something I would really like to do because it really sits down and tells you, what you should be eating, how much you should be eating and all of that.
absolutely. So, Dr. Seema, thank you for really taking us inside the world of blood chemistry in a way that's not just scientific, but actionable. And you've really shown us how labs can guide nutrition, training, and even mindset. So, the next episode, we're diving into how the body signals imbalance long before symptoms, the early alerts, and most people tend to miss. So, until then, this has been another great episode with Dr. Seema of Achieving Unlimited Health. And thank you for helping us understand our bodies one clue at a time. I can't wait for the next episode to dive in a little bit further.
Thank you, Leila.